Every year, millions of seniors walk into clinics for what they believe is just a routine checkup, a simple scan, a follow-up test, a harmless screening. But what if I told you that some of the most common medical tests, the ones you've been told are essential, could actually raise your risk of stroke overnight? It sounds unthinkable, doesn't it? You trust your doctor. You follow every recommendation. But buried beneath the calm surface of modern healthcare are hidden risks no one warns you about. Not the clinic flyers, not the morning news, and sometimes not even your physician. Picture this. You walk out of your appointment feeling fine, but the next day, dizziness sets in. Your vision blurs, or worse, a stroke strikes out of nowhere. And all you're left thinking is, wasn't that just a simple test? Now, to be clear, this video isn't here to scare you. It's here to inform and empower. Because after 60, it's not just about detecting illness. It's about avoiding harm from procedures that might do more damage than good. In the next few minutes, we'll uncover the 5 most common medical tests that may quietly raise stroke risk. And more importantly, how to protect yourself before your next appointment. If you're over 60, drop a 1 in the comments. Let's see how many of us are navigating this chapter together. If you're not yet, type a 0 and stick around, because this might be the knowledge that helps you or someone you love. And don't forget to subscribe to Senior Vital Health, where we uncover the truths no one else talks about. Medical test number 5, CT scan with contrast. Let's begin with a test that's often used in hospitals and emergency rooms across the country, the CT scan with contrast. You may remember the sensation, a warm, flushed feeling as the dye spreads through your veins. It helps the doctor see blood vessels and tissues in greater detail. Sounds like a lifesaver, right? But here's the hidden truth. That contrast dye, while helpful for imaging, can trigger serious side effects in vulnerable adults. For seniors, especially those with high blood pressure, kidney issues, or heart disease, this injection can strain your cardiovascular system in dangerous ways. Some patients experience sudden drops in blood pressure and heart rate, what's known as a vasovagal response, leading to fainting or nausea. But others may see the opposite, sharp spikes in blood pressure, blood vessel spasms, or even clot formation. These shifts may silently tip the balance toward a stroke, especially if the body is already weakened. A study published in the Journal of Vascular and Interventional Radiology found that seniors who received contrast-enhanced CT scans were significantly more likely to experience vascular complications within 72 hours, especially those with hypertension or kidney impairment. Take Harold, 81. He visited his doctor for mild stomach discomfort and was sent for a routine CT scan with contrast. The scan came back clear. But 2 days later, Harold suffered a minor stroke. The likely trigger? A sudden rise in blood pressure from the dye, which led to a clot-blocking blood flow to part of his brain. Now, this doesn't mean all CT scans with contrast are dangerous. These tests can save lives when used appropriately, but they shouldn't be automatic. Before you agree to one, ask, is this test essential for my case? And is there a safer alternative, like a non-contrast CT or ultrasound? If you have kidney disease, heart issues, or past reactions to dyes, speak up. Ask your doctor, can we do this without contrast? You have the right to know. Coming up next, a test that sounds simple, even beneficial, but could be putting seniors in serious danger during the exam itself. Medical test number 4, stress test, treadmill test. Let's now talk about the exercise stress test, a test many seniors are told to take to check on the heart. You've probably seen it in movies. You're hooked up to wires, walking on a treadmill, while doctors monitor your heart activity. It sounds smart, a proactive way to catch problems early. But for seniors over 60, especially those with high blood pressure or existing heart conditions, this test can carry more risk than reward. Here's why. During the test, you're asked to increase your walking pace, sometimes even jog. As you move faster, your heart rate spikes, your blood pressure rises, and your cardiovascular system, already aging, is suddenly pushed to its limit. In a younger body, this stress can be tolerated. But in seniors, it can trigger irregular heart rhythms, blood pressure surges, or even damage to fragile blood vessels, especially in the brain. One wrong spike, and a stroke can follow. A 2020 study in the American Journal of Cardiology examined over 1,300 adults aged 65 and up who underwent treadmill stress tests. Nearly 7% experienced serious events, including sudden arrhythmias and dangerous blood pressure spikes, during or shortly after the test. And those most affected? Seniors with pre-existing vascular issues. Take Margaret, one of our longtime subscribers from Ohio. At 74, her doctor suggested a stress test just to check in. She wasn't experiencing chest pain, fatigue, or shortness of breath. But halfway through the treadmill portion, Margaret became dizzy and felt tightness in her chest. The test was stopped, but the next day, she suffered a minor stroke. Doctors later believed the sudden cardiovascular strain ruptured a delicate vessel in her brain. To be clear, the stress test didn't directly cause the stroke, but it added stress to a vulnerable system. So before you take this test, ask your doctor, is there a safer way to assess my heart? A nuclear stress test, where medication simulates exercise, or a resting echocardiogram may be safer alternatives for older adults. And if you're not showing symptoms, ask, do I really need this right now, or can we wait? Coming up next, a routine test that millions of seniors undergo each year, one that involves sedation and may quietly disturb your brain's circulation. Medical test number 3, endoscopy with sedation. Now let's talk about a procedure that becomes increasingly common after age 60, the endoscopy. Whether it's to check your esophagus, stomach, or colon, doctors often recommend it just to be safe. And while endoscopies can be valuable in the right circumstances, there's a hidden risk most seniors are never told about, especially when sedation is involved. Here's the problem. Many older adults take medications like aspirin, Plavix, or other blood thinners daily. These drugs, combined with sedation during an endoscopy, can create a dangerous mix. Sedation naturally lowers your blood pressure and slows your circulation. When you add blood thinners into that equation, it becomes harder for your body to regulate blood flow, increasing the risk of internal bleeding, oxygen drops, or even mini strokes caused by poor brain circulation. In 2021, a large-scale review in the journal Gastrointestinal Endoscopy analyzed outcomes in seniors over 65 who underwent sedated endoscopy procedures. The findings were alarming. There was a noticeable spike in transient ischemic attacks, or TIAs, within 72 hours of the procedure. These mini strokes may not cause permanent damage, but they are often early warning signs that a larger stroke could be coming. One story we'll never forget is from Dolores, a 76-year-old woman from Florida. She went in for a routine colonoscopy with sedation. No symptoms, no complaints, just a precautionary test. 2 days later, she began slurring her words and couldn't maintain her balance. She was rushed to the ER, where doctors confirmed she had experienced a mild stroke. The likely culprit? The combination of her daily aspirin and the drop in blood pressure during sedation allowed a small clot to reach her brain. Does this mean endoscopies are unsafe? Not at all. They can detect ulcers, tumors, or internal bleeding, but they shouldn't be done just because. If your doctor suggests one, ask, Do I really need this test right now? And are there symptoms we're investigating? Always make sure your doctor knows exactly what medications you're taking. Ask, should I stop my blood thinner before the test? And what are the risks of sedation at my age? In many cases, lighter sedation or even no sedation at all may be an option. Coming up next, a test that uses powerful imaging technology, but adds a chemical twist that could put your kidneys and your brain at risk. Medical test number 2, MRI with contrast. MRIs are some of the most advanced and useful imaging tools in medicine today. They allow doctors to peer deep into your body, catching early signs of disease, guiding treatment decisions, and helping avoid unnecessary surgeries. But when that MRI involves contrast dye, particularly for seniors, a new set of concerns quietly emerges. Most contrast-enhanced MRIs use a substance called gadolinium, a heavy metal. It's meant to be filtered out by your kidneys after the scan. And in younger, healthy adults, that process usually goes smoothly. But as we age, kidney function naturally declines, even without us knowing it. And if you have mild or undiagnosed kidney disease, your body might not eliminate the gadolinium efficiently. This means it can linger. And that's when the problems start. Gadolinium buildup has been linked to a rare but dangerous condition called nephrogenic systemic fibrosis, or NSF, which causes thickening of the skin and connective tissues. In severe cases, it can limit mobility, breathing, and lead to life-threatening complications. But here's what many don't know. Trace amounts of gadolinium have also been found in the brain, even years after a scan. And researchers now suspect that for seniors with circulatory issues, this retained metal could trigger stroke-like symptoms, confusion, or balance problems. A 2019 study in the journal Radiology followed over 2,000 adults over the age of 65 who underwent contrast-enhanced MRIs. Within 7 days, about 5% reported symptoms like headaches, dizziness, blurred vision, or foggy thinking. While not full strokes, these were warning signs, and most occurred in patients with pre-existing kidney problems, many of which were only discovered after the symptoms began. Take Harold, a 79-year-old veteran from Arizona. He went in for an MRI with contrast after months of back pain. The scan helped rule out a serious issue, but no one tested his kidney function first. 2 days later, he felt disoriented, weak, and mentally foggy. A blood test later revealed stage 3 kidney disease that had gone unnoticed. "No one warned me," he said. "If I had known, I would have asked more questions." So here's what you can do. If your doctor recommends an MRI with contrast, ask, is the contrast really necessary, or can we do the scan without it? In many cases, a non-contrast MRI still offers valuable insight. And if contrast is essential, request a simple blood test called a GFR. It measures kidney function and can reveal whether your body is ready to handle the dye. Always inform your doctor if you've had unusual symptoms after scans in the past, and don't hesitate to ask about safer options. Next, we're turning to the final test, one that seems harmless, even helpful, but may be quietly steering seniors toward unnecessary surgeries that bring more risk than reward. Medical test. Number 1, carotid artery ultrasound. Now let's talk about a test that seems completely harmless on the surface, the carotid artery ultrasound. It's painless, non-invasive, doesn't involve needles, radiation, or contrast dye. In fact, it's often promoted as a smart preventive measure for seniors. But here's the catch. If you're symptom-free, this routine test could be the first step toward a surgery you didn't need, and one that may increase your risk of stroke rather than prevent it. The carotid arteries run up each side of your neck, supplying blood to your brain. As we age, it's normal for these arteries to accumulate plaque, the same way pipes in your home might build up minerals over time. But not all plaque is dangerous. Mild to moderate narrowing is often stable and doesn't require surgery. Unfortunately, if a scan detects even 50 to 60% narrowing, many doctors automatically refer patients to vascular surgeons. And that's where things can go wrong. Procedures like carotid endarterectomy or stenting can be life-saving in the right cases. But in patients without symptoms, no dizziness, weakness, or vision problems, the benefit is often small. And the procedure itself carries serious risks. A major study in the New England Journal of Medicine tracked over 3,000 seniors with moderate carotid narrowing but no symptoms. Many of them saw no added benefit from surgery compared to lifestyle changes and medication. Worse, some suffered strokes during or shortly after the procedure, the very outcome the test was supposed to prevent. Helen, 82, from Pennsylvania, knows this story all too well. She felt perfectly healthy, but was sent for a carotid ultrasound just to be thorough. It showed 65% narrowing. Within weeks, she underwent surgery. During the procedure, a small clot dislodged and caused a stroke. She survived, but now lives with weakness on her right side. "I wish I had asked more questions," she said. "I didn't know doing nothing was even an option." So before you say yes to this scan, ask, what are we looking for? And what will we do if we find it? If the scan won't change your treatment, if you're already taking blood pressure meds and cholesterol drugs, living a heart-healthy lifestyle, you may not need it at all. And if narrowing is found, ask about repeat scans and second opinions. The decision to operate should be based on symptoms, not just numbers. Let's take a moment to bring everything together. Not every medical test is harmful. Many save lives. But not every test is necessary, especially after age 60. Our bodies become more sensitive. Procedures that once seemed routine, like a dye injection, a treadmill run, or light sedation, can cause ripple effects when layered on top of age-related health challenges. A test might spike your blood pressure, a scan might stress your kidneys, a well-meaning checkup might lead to a surgery you didn't actually need. That's why the most important tool you have isn't a machine or a medication. It's your voice. You have every right to pause, to ask, to understand, to say, is this test absolutely essential? Or, are there safer alternatives for someone my age? When you ask questions, you protect your health. When you speak up, you take back control. And when you're informed, truly informed, you make better decisions, not just for yourself, but for your family too. You deserve care that's cautious, personalized, and rooted in respect. If you've ever felt strange after a medical test, or if someone you love went through something unexpected, type 100% in the comments. If not, type 0 point. Let's share, connect, and support each other. And if this video made you feel even a little more aware or in control, subscribe to Senior Vital Health. We're here to ask the hard questions and protect your future, one honest video at a time.